are some important resources that you'll always want to have at hand throughout your entire time here at Mercy College. One of those is the program Handbook. So what I would like to do in this video is to go over and highlight some of the sections of the program Handbook. Now, by all means or any means, this is not meant to be an inclusive review of everything in the handbook. You will want to take that, download that PDF, keep it in your laptop, and review it, the entire contents of the handbook. But I want to highlight some of the sections that historically students have used the most, so you know what's in the handbook and where to go. A lot of times you can find many of the answers that you have within the handbook. And of course, another resource that we'll talk about is the college catalog, but that'll be in a separate video. But between those two resources, many questions can be answered there. So with that, let's jump in and look at the handbook. Well, let's begin our review of the program handbook with a disclaimer. And on page 3 of the handbook, our disclaimer basically says that the information can be changed at any time, but we do make a good faith effort to try to make sure everything is correct and accurate at the time that we produce the handbook. We do edit the handbook every academic year. So that's something that you do want to download after today's little presentation. Please download that PDF and keep it on your laptop. You can find many answers to questions that you have right there. Okay, well, let's go over some of the things that students refer to the most in the medical imaging handbook. And let me increase the size of the handbook a little bit here so we can get a better look at it. There is that disclaimer on page 3. Now I'm going to again just hit the highlights of it, and moving on to page 5. This page is kind of important. It really encapsulates the mission of the program and our foundation. So the first part of that is the accreditation. We are accredited by the Higher Learning Commission, Mercy College, and the Higher Learning Commission has authorized us to offer this degree. Now, so what? What does that mean, Higher Learning Commission? Well, it is kind of a big deal. The Department of Education has basically carved up the United States into zones, kind of like Midwest, West, Hawaii, and California have their own. But basically, it's carved up into about a half a dozen major zones. And they have basically authorized these entities to accredit institutions of higher learning with pretty much, this is the highest level of accreditation that you can get. A lot of you I've talked to through the admissions process, and we've talked about what regional accreditation means, and that's what this is. For example, Harvard, University of Michigan, UCLA, Notre Dame, all these schools are regionally accredited, and so is Mercy College. How this benefits you is a lot of times employers will only offer tuition reimbursement if you are going to a regionally accredited school. So know that you have that. No worries there. Okay, so that's accreditation. Program mission statement. This is, again, kind of an important thing, why you're here and why we're here to deliver this education to you. And our mission statement says, it is to support career advancement and academic progression by providing a balanced plan of study for medical imaging professionals in a flexible, responsive, and engaging learning environment. That's what really it's all about. Again, that career advancement, that career enrichment. Advancement means different things to different people. Sometimes it's a lateral move. Sometimes it is a, moving up. So the program tries to address that term of advancement in many different ways by providing a really broad spectrum education. Program goals. This is what our goal is by the time you graduate. This is what we hoped we have done through your time here. And one is to prepare you for successful career progression in medical imaging. Again, progression is defined a little bit differently for everybody, but we try to cover as much as possible as far as that general definition of progression. We want to provide students with a balanced and diversified plan of study to promote multiple career opportunities. So not only do we want you to progress, we want you to have different channels of that progression. It's just not about CT and MRI. It's about a lot more than that. And that's what this multiple career opportunities phrase means. And then the other goal that we have is to prepare students for continuing on with their education. Some of you will go on and get your master's degree. You might get an MBA, maybe a master's in public health, but some of you will continue on. We hope that you do. And we're going to give you that foundation to move to the graduate level. Program learning outcomes. This section really says how we meet those goals. So those goals are nice, but what are we doing to meet those goals? And we basically say that when you have completed the program, you can do these following things. 1, you can demonstrate knowledge of advanced imaging modalities that supports post-primary certification. Most of you should know what post-primary certification is. That is getting those extra initials behind your name. And we support a lot of different modalities as you're going through here. So it's not always CT and MR, but we definitely hit on those modalities. Are very huge in imaging, and you have to have a good knowledge of that if you want to have a career in medical imaging. So you have CT, MR, quality management, and CIIP, just to name a few. So those are some of the... We want you to have that knowledge to be able to sit for those exams. You're going to have that theoretical knowledge that are on specific post-primary certification exams. Our second learning outcome, exhibit the essential managerial skills necessary for the direction in a medical imaging department. Some of you will move on into leadership roles. That is our goal. We have had folks who have gone through the program and have moved into supervisory and managerial roles. It's very exciting to see the next generation of leadership coming out of this program. And then number 3, to understand the role of research and supportive technical applications in medical imaging. You're going to have a class in research, and the supportive technical applications would be quality management and medical imaging informatics. Again, 2 possible career avenues that you may find yourself in down the road. So those are the program learning outcomes. This section is really, really key. So page 5 is kind of why we're all here. Now let's look at some other features of the program. We're going to go to page 9. This one comes up quite a bit. There is, for those of you out there that do not have an associate's degree, you are what we call a pathway student. That means you have a certificate in probably radiologic technology in most cases. This describes a little bit about that pathway process, and most of you have already worked very closely with Aaron House with your plans of study. Basically, it means that a pathway student still needs to meet graduation requirements. There are basic graduation requirements for all baccalaureate degrees. Those must be met. It also states that for those folks who have certificate educations, we do grant you college credit by verification of your primary certifications that you have. So it's a great mechanism for you to continue on with your degree and give you college credit, because we know that you have a body of knowledge out there that you did, but it just unfortunately was not in a regionally accredited institution. But no worries there. So that talks a little bit about the pathway process. The other section is credit for prior learning. And many of you have already taken advantage of this. Basically, what credit for prior learning is all about is those post-primary certifications. If you have some of those in specific areas that we address through the curriculum, you're going to get college credit for those. And you won't need to take those courses because obviously you know that you have the body of knowledge. Now, almost all of you should have we verified your credentials before you started the program and waived and gave you college credit for those courses. What can happen, and often does just about every semester, a student will obtain one of these credentials after they're already in the program. So if this should ever happen to you, and I'll pick on CT because it is the most popular one. Let's say, for example, you're not a CT tech now, but in a few months or maybe in a year, you become a CT tech. Definitely let us know, and you've taken the registry and you've passed the registry, definitely let us know, and we will see if there's any coursework that can be waived for you. Now, you may have already taken that coursework to get yourself ready for the registry, or you may still have one or two courses left. We're obviously going to waive that coursework for you and give you college credit for it. So the credentials that you want to look for, those certifications that you, if you obtain those down the road, are CT, MRI, or MR, QM for quality management, CIIP, and those folks know what that is. Most rad techs do not know what that is, but that is a very, very interesting certification, and that's Certified Imaging Informatics Professional. So, and you'll learn about that as you go through the program. It is a little-known avenue of employment, which is great because it can be, you know, if you're one of the few folks that are specialized in that area, it can be very beneficial for you. And the other one is CRA, it's Certified Radiology Administrator. And those folks have a tremendous body of knowledge in the business of healthcare. So if you ever obtain any one of those certifications that I just mentioned throughout the program, please let us know, myself or Aaron House, and we'll see what courses that you're no longer going to be needed to take, and we'll waive that credit for you. Now, it comes up, the other question is, well, Chris, why I'm a MAMS tech, why can't I get credit for MAMS? The credit that we give is specifically tied into courses that you would have normally have taken, and we do not have a MAMS course, so we can't just give credit for courses that don't exist. So it has to actually match part of the curriculum that you would have taken anyway. So no reason to, we're not trying to pick on MAMS or radiation therapy or some of the other post-primary certifications out there. It just doesn't tie into the curriculum, which it has to if we're going to give you college credit. Okay, excellent. Now let's move on to page 14. Here I want to talk about our confidentiality of protected information. You can read this in its entirety, but it basically means HIPAA, and we're all healthcare workers, so we know what that means. But please, please do read this. But it follows all of the intent of HIPAA from the college's end. Now, how could HIPAA be applicable in the program? Well, let's say, for example, some of you are out there in our optional CT clinical. We have an optional clinical piece to the program. You're obviously dealing with patients on a daily basis. That would apply. You might be taking a class, and you might be looking at some images. Now, the instructor should scrub all that information off of there. But we are a teaching institution. We are allowed to look at those images. So maybe a mistake happens, and you see a patient identifier on an image in class. Again, we're a teaching organization. We are allowed to pull right off the packs for in-class use. Our practice is to try to remove patient identifiers, but if that should ever slip by and you see patient identifiers on there, again, this is where the confidentiality of protected information would apply. Okay, so enough of that. The next section I'd like to draw your attention to is student representation. This is still on page 14. You're going to have a student rep. Every year, in the fall, we look for 2 student reps to join our direction committee that helps direct and guide and advise the program. and we really embrace student input in the direction of the program, and has been very, very beneficial over the years having students involved. So please think about if you're interested in being a student rep, we're going to there'll be a big advertisement, if you will, for volunteers. If we have multiple individuals, we might have a little bit of an election involved. Now, many of you live hundreds of miles away from Mercy College, if not 1,000 miles away from Mercy College. How would you attend? Well, you can attend at a distance through the easiest way that we do it is through phone conference. You'll conference in on those days that we have our advisory meetings. We've even entertained the idea of Skype as well, or something like Skype, to bring those students that are at a distance into the advisory process. So don't let that stop you if you cannot be here physically. Do know we have 2 meetings a year, and one in the fall and one in the spring. Okay. Now let's move on to page 17. Okay, the next thing I'd like to bring your attention to is how would a student fail out of the program? This has actually never happened with us, but it is important to know. And there's generally 2 ways that you could fail out of the program. One is you continuously fail your general education coursework. That's your non-professional core courses. Let's say, for example, a sociology course, a psychology course, an English course, a religious studies course. Those are not your core professional courses. Your core professional courses are designated as your imaging courses, the IMG courses, the healthcare administration course, or the BOS courses that are defined already in the program that you have to take to graduate. If you fail those more than twice, then you may be dismissed from the program. This is never going to happen to you, I should hope, and has never happened in the life of the program. So, and know that if you're ever in a situation where you think your academics is not where it should be, definitely seek help from us so we can avoid a situation like this. Okay, let's move on to page 19. And this one is more of a kind of a notice, and that's on licensure status. If for any reason you lose your license as a radiographer or nuclear medicine technologist or as a MRI tech, any of those primary pathways, you must let us know. You are required to have that current while you're in the program. Now, obviously, you're in a medical imaging program. You're committed professionals. This is not going to happen unless there was some event that caused you to forfeit, I would think, your license. Please let us know if this should ever happen. Again, it could lead to possible dismissal of the program if you have lost licensure status. But again, talk to us if you are ever in this situation. Again, luckily, we have never had a student who has been in this situation. Okay, now, again, those are some of the highlights of the handbook. One thing that you'll need to do, and I'm going to go to the last page on here, is we have an acknowledgement. It basically says, I received my copy of the handbook, and I've got it. And you're going to signature your name on there. You can use it digitally just by typing your name and dating that. In the module, you'll find this particular document as a Word document, so you can simply fill in your name at the top, sign your name at the bottom via just typing would be fine, and dating it, and then you'll put that in the Dropbox. So please do that after you've downloaded the PDF of the program handbook. Okay, excellent. Thank you very much for your attention as we went through these kind of the most common items within the handbook. Please take time to go through there. There is a table of contents so you can find things right away. but have a good familiarity of what's in the handbook, so when those questions come up, you know where to go. Excellent. All right. Well, thank you very much, and as always, thank you for watching.